Plantar fasciitis is a chronic inappropriate inflammation and an inability of the plantar fascia to heal, and it usually happens right where the plantar fascia connects or inserts into the calcaneal bone of the foot or the heel. And so this can definitely be brought on by a increase in activity acutely or by an acute injury. But it's my theory that there's an underlying problem with the fascia that predisposes it to injury. So if you just bought a home with hardwood floors, or you've just started climbing lots of extra steps at work, this can definitely precipitate an episode of plantar fasciitis if the fascia is already weakened by the things that I'm going to talk about at the end of this video. There is a specific point on the medial side of the heel that if the doctor presses it, it replicates the intense pain that you have with plantar fasciitis when you first get out of bed and take those first few steps each morning. And indeed, this was the point I was palpating when my patient hit me. If the diagnosis is in question, then also ultrasound and magnetic resonance imaging can be used to nail this diagnosis down definitively. If this is your first bout with plantar fasciitis, you've never had it before and you've only had it for a few weeks and you go see your doctor, then the current treatment recommendations work for about 80% of people, and that's a series of stretches that you can do, ice massage. One of the best things that patients gave me feedback was I would tell them to take a 20-ounce water bottle, fill it up with water, put it in the freezer, let it freeze, and then do an ice massage by rolling their foot on that frozen ice bottle. That seemed to help people with the symptoms quite a bit. Anti-inflammatories like ibuprofen or Aleve of the prescription anti-inflammatories will definitely give relief of the acute symptoms, but they don't treat the underlying root cause. Steroids in the same vein by mouth will treat the symptoms, but not the underlying root cause. But then also you can have a steroid injection around the plantar fasciitis. It hurts like crazy, but it provides immediate relief. And then the relief can last for a few weeks for most people, and in some people a few months. There's also been some shockwave therapy treatments, the same kind of shock waves that we use to break up kidney stones. In some people provide very good relief. And then a couple of other still sort of experimental treatments would be prolotherapy and platelet-rich plasma. Both of these are injection therapies, one injecting kind of a sugar water around the fascia, the other injecting your own platelet-rich plasma back around this to help stimulate the healing factors and growth factors to see if we can't get this fascia to heal.
Edited and summarized, easy to share with loved ones. The description below the title for this video has these summary points.